I want to thank you for this opportunity to testify here today. I'm president of the AIDS Healthcare Foundation, and we are the nation's largest AIDS provider and also the largest in the state of Florida. And I come here today to propose an alternative to the reduction in the federal poverty limit. And it's basically a 5-point plan. First of all, we propose that there be an across-the-board 20% reduction in the cost of the medications to increase the rebates from the drug companies. Florida participates in a national negotiation, but unfortunately, that's not rendering the type of reductions that are needed. And there's nothing that requires Florida to negotiate as part of a consortium. And since they have the worst situation in the country, we recommend that they immediately start those negotiations. AIDS Healthcare Foundation is leading a national effort which has so far succeeded in getting at least one of the companies to reduce their prices by 8%. And we believe if the state of Florida steps up to the plate, we can do more. Secondly, we would propose, right now, the ADAP program in the state of Florida is bleeding out. You are paying for Medicare recipients through ADAP because you do not have a system to document that people are in the donut hole. And so even when they get out of the donut hole, they're still being charged to ADAP. So at a time when we have almost 4,000 people on a waiting list and you're considering lowering the federal poverty limit to permanently eliminate thousands of people from the program, Florida has not done what most other states have done, which is to take advantage of the coordination of benefits, since as a result of healthcare reform, it's been determined that ADAP can count towards the true out-of-pocket expense. We've brought this to the attention of the department for a very, very long time, and we've said that we would help you to solve the problem. But meanwhile, it's now May. This has been in effect since January 1. People came out of the donut hole as late as the end of January, and it's still being charged. The third suggestion is that from our anecdotal experience, there are many people on the ADAP program in Florida who are Medicaid eligible. And the system of qualifying them for Medicaid is not being properly done. And so more of a burden is falling to ADAP than is necessary. Next, we would say that there's no utilization management system in place in ADAP. If a doctor DCs a prescription, if a doctor discontinues it, okay, the pharmacy can continue to fill it. Nobody's looking at the drug profiles to minimize them. So therefore, you have a situation where we believe that the expenditures under ADAP are at least 10% higher than they need to be without any change in the medications that patients receive. We also believe that the maximization of using generics in place of branded drugs needs to be reviewed. And again, AIDS Healthcare Foundation has offered the state of Florida assistance in this regard, since we operate health plans and we know how to do that. And the last piece of it is that Florida's contribution as a percentage of the Florida ADAP program has fallen consistently over the last few years. And this is primarily funded by the federal government, this program. But at least the very small percentage that Florida has contributed should be maintained. These are Floridians. I mean, the people you see here are Floridians. They deserve that care and attention. So, we continuously have come to you not just with an outcry, but with a solution. And we think it's incumbent upon the state to look for a better solution. I mean, the reality of the matter is that people who are on a waiting list will get off the waiting list at some point. People who are dropped will disappear from the system. And we know that people who are underserved and face many challenges, don't normally advocate the way you are seeing here. This is the worst solution possible, is to lower the federal poverty limit. And we're glad that you had these meetings, but when the rule change itself, if that goes forward, I hope you will deliver the message to Governor Scott that we are going to lay this directly at his doorstep. We have a lot of experience, back to Governor Christ, in this type of advocacy. And I will tell you right here and now that we will not rest until this proposal is firmly and permanently defeated.
Hear, hear.